Unpaid for my tuition. Unpaid for my tuition. Unpaid for my tuition.
Hello, Yang. Welcome to Refugee Talk.
Thank you for having me.
Thank you very much for accepting our invitation. Yong is from South Korea, and let's hear how did she start her journey in Canada.
I like that you said South Korea. One of my pet peeves is that when South Koreans say they're from Korea, like North Korea doesn't exist. Anyways, yes, hi. My name is Yong. I'm from South Korea. I started working, after I moved to Canada, I started working for this international student agency where we had some Korean international students studying very hard, studying English. And they had some issues with their health concerns, sometimes some legal concerns. So they were asking me to accompany them to doctors' offices or lawyers' offices so I can interpret for them.
Right.
And then I really liked it. Not just for the fact that I can show off my language skills, speaking two different languages, but also that this really helps people. Like without that language connection, they wouldn't have had without me.
Right.
They can communicate, they can solve problems, resolve some conflicts, misunderstanding. I really like the aspect of it. And after I started working as an interpreter, I got into more into that aspect because whenever I walked into the room as an interpreter, I see their face just lit up and be so happy to see me. So that really got me addicted.
Right. Thank you for sharing. I have a bunch of questions. I know that we have less times, but I would like to ask this question. Have you seen positive examples where proper language access helped refugees build trust in the healthcare or system, social system?
So much. So a lot of newcomers and refugees, they didn't even know that this service existed. And when they realized that this service exists, not only exists, but offered to them for free and paid by government, they felt welcomed.
Right.
They felt accepted as one of the social members in Canada, not as outsider, not as newcomers or refugees coming from outside the world somewhere else. They felt accepted that people here, they want to communicate with us through interpreters so they can actually listen to our voices. So yeah, it's huge. And then from there, we build trust because we can really show that we want to hear from you.
Right.
Through interpreters, but through your voice directly.
Right.
So that builds a lot of trust, yeah.
That really makes sense, actually. I have used interpretation when I was refugee back in Turkey, Yong, and it really helped me to get the access, to get the resources. Because if there was no interpretation system, I could be lost.
Yeah.
I could get no resources because I know we have AI right now, we have Google Translate and all, but interpretation when a person, human being, translate or interpret, it's totally different, something else.
Because we can add cultural aspect and understanding on our interpretation that is lacking in AI translation.
Definitely.
AI translation is useful in some senses, but it's definitely lacking some deep understanding of what the voice wants to convey. Yeah.
Right. And can you also share with us some of the experiences that you helped the newcomers in Canada with interpretation and moments that you would never forget because it was quite difficult for you or it was memorable for you at that time?
So, well, I'm from South Korea, but I had some experience helping North Korean refugees in South Korea. So I learned their dialect. So, and for I don't know, political reason or whatever reason they may have, Korean interpreters were a bit reluctant to interpret for North Korean refugees.
Right.
So I think other Korean interpreter joined later, but for a short while, I was the only interpreter who was willing to interpret for North Korean refugees. So I think it was for a few years where we had a lot of influx of North Korean refugees coming into Canada. And a lot of them, they escaped North Korea, went to other countries, and then came to Canada. And some of them actually went to South Korea and then came here as a refugee as well. So they always felt like they went somewhere, rejected. They went somewhere else, not accepted. And they moved around so much. They're so emotionally and mentally exhausted and scared at the same time. But when Canada showed them they care and provided an interpreter, and then they saw that all these people's workers, different societies, trying to communicate with the North Korean refugees and try to really hear their voices through interpreters, day by day, they felt really relaxed. And then at the end, they always said, like, here in Canada, we finally felt accepted.
Right.
And that was actually really big thing. It really made my day.
Yong, actually, you mentioned a very interesting point about North Korean refugees. I don't know if it is out of scope. You may just tell me no. I don't want to answer that question. Tell me more about the North Korean refugees that crossed the border, entered South Korea. You saw their faces. Tell me more about it. If it is out of scope, please just ignore it. We will go to the next question.
Yeah, let's go to the next question.
Thank you very much. I have another question. How do language barriers affect refugees, women, especially in the areas of maternal care or gender-based violence support?
That's so. Growing up in South Korea, I'm coming from a family with domestic violence. I witnessed it growing up. So it's something, at first it was very hard for me to interpret in. The setting was quite hard for me emotionally. So I tried really hard to be neutral. But it was really hard because I saw my mom in a lot of women I interpreted for.
Right.
And especially for Korean community, some people, they come here as a business investment, immigration program. And when domestic violence happens, sometimes it's wife being violent toward the husband. It does exist, but a lot of cases is that husband being violent toward wife. And usually these women, they were married and then became housewives and didn't have much of the social interaction in South Korea. They moved here without the language skills, and then they stayed as housewife, which made them isolated because they're focused on raising children. And their children now became teenager. They don't talk to her in Korean anymore. They all speak English. Their husband went outside, doing all the business outside, speaking English. So she feels isolated from outside, but also domestically. And then something happens, the husband became violent toward them, and they are afraid, and they don't know who to talk to. And also it's not something you can easily talk to your neighbors about. So they have a shame, guilt, embarrassment, and also they are emotionally abused. So all these things are very, very like on top of their head and body, physically, mentally, emotionally. And then interpreter shows up.
Right.
And they can really talk about themselves. They can voice up, and then they can talk about what they want. And then it's life-changing moment for them to have their own voice.
Right.
And they feel heard. So that's one case, if they're married to Korean. Another case is some women, they come here getting married to Canadian who are not Korean. Or actually sometimes they are Korean Canadian too. And through that husband, they earn permanent residency status.
Right.
And because of the language barrier, these women, they didn't actually read what is written on the immigration document. So in some cases, I interpreted for the husband lied to the wife and saying that because you earned your permanent residency through me, I can report you anytime. If you don't listen to me, they will deport you. So that's why some women, they were just living with this abusive husband for years and years, just living in a hell because they didn't know until things blown out of proportion, and then social worker and police got involved, and then interpreter comes, and then she find out the truth, and then she finally gains some independency and get divorced and all that. So we are not just giving them voice, we are giving them agency,
right,
for their own lives.
Saying that that's a very, very difficult situation to see you. You're trapped in a rabbit hole. Sometimes I call it rabbit hole when someone is stuck in a situation, especially when you're a newcomer, you don't know anything. You're stuck in a rabbit hole, and that's really disturbing when a man does that. I'm really sorry.
Yeah, it is a sad situation.
I would like to ask you that I saw your LinkedIn. You have your own company for interpretation. Can you also tell me about it and your position and how it's going with that?
There's actually a funny story. So it's not a company, it's a non-profit organization that I founded in 2015. It's called the Bilinguals International.
Right.
So this might be related to your other questions. I'll just start from why I founded that organization.
Right.
So I was away for my study, for master's in Australia, and then I finally came back to Canada in 2010, started working as a medical interpreter, more focused on medical interpreter. Because before I was doing business interpreting, conference interpreting, community interpreting, legal interpreting. I was doing a lot of different interpretation in different industries.
Right.
But when I came back in 2010, I focused more in medical interpreting only. So I was going to the hospital every day, 6-7 different appointments. I was jumping around different buildings. And then I noticed that there was definitely some issues in utilizing interpreting services, like 5-6 different issues. And I try to address that with different health authorities, making a phone call, emailing, different clinics. I try to offer some of my experience. I share my experience saying that, well, in this case, you should not use bilingual family members. You should not use bilingual staff. You should use professional interpreters. And also, you need to learn how to work with interpreters. I try to email them all those. But no one was emailing me back because I was just an interpreter talking about it. Also, maybe they thought that I just email them these things so I can make more money.
Right.
So I was like, okay, no one's listening to me. What if I make myself executive director somewhere? So I was thinking, maybe I can just found my own nonprofit organization and put me as executive director.
Right.
And then email them with better looking position.
Right.
So I founded a nonprofit organization with the federal government, and then I started emailing them as an executive director. And then people started emailing me back, calling me back. So what we offer is not an interpreting service.
Okay.
We offer training workshops to healthcare professionals, legal professionals, and social workers on how to work with interpreters.
Perfect. That sounds amazing, and I'm sorry, and I'm so sorry that what you have been through. I totally agree with what you said. Unless you don't have like the world is too blind. When they see you in a low position, they think, oh, that's not an important email, which is really wrong actually. Anyways, going forward, how can refugees refugee serving organization better advocate for language access in their in their communities? Like, there are so many organizations right now in Vancouver. How can they improve? And I would, if you can give me some examples also, please.
So one of the things I want, there are a few different issues, but one of the things I really want to emphasize, especially for organizations like Mosaic, and also ISSBC, Success and Diversity, there are amazing organizations helping newcomers and refugees, and especially the settlement workers.
Right.
They're amazing.
Thank you.
Yes, because you are like so caring, going out of your way to help. And I also saw that some settlement workers going out of their way to sometimes helping newcomers making a phone calls, getting connected with someone. But one thing I really want to emphasize, and I really want some manager and leadership level of organization to hear this, is that do not burden your bilingual settlement workers as an interpreter. Just because your settlement worker speaks 2 languages, that doesn't mean that they need to work as an interpreter, which is not on their job description.
Right.
They're not paying extra for that. And also these bilingual staff, they are not trained to do the interpretation or having the burden of the emotional burden they need to have. And also, to be fair for the newcomers and refugees, they have right to have professional interpreters who are trained with interpreter skills, note-taking skills, memory skills, all the terminology in medical, legal, social services, and who can remain neutral.
Right.
Because settlement workers are not neutral. And also because our settlement workers care so much for the newcomers and refugees, they may add, omit, and edit what the person is saying to help them.
Right.
But in some cases, it backfires.
Right.
And so burdening bilingual staff with the role of interpreter is not fair, especially in health, not in the immigration services because we don't actually have enough research data for that. But in healthcare services, we have a lot of evidence that bilingual staff and nurses especially, burdening them with extra cultural, as a cultural broker and interpreter, put them on emotional toll, and they have some burnout from that. And that's just unfair for everyone.
Interesting. What you just mentioned, I guess it just opened my eyes, and possibly I've never noticed it. Yes. I mean, if you're a settlement worker, myself, I'm a settlement worker also. I'm not an interpreter, and then I cannot. If I speak the language, it doesn't mean I can I can do interpretation with the client, because the words, the vocabulary that they use is totally different. Even if it is your mother tongue language, there has to be a professional interpretation for that.
You can do your job in your language.
Yeah. Okay.
That's
okay, right?
Of course, it's
okay.
It's your job.
Okay.
Yeah, but interpreting is different because you're interpreting someone else's word into another language.
Right.
It's not coming from you.
Right.
And what we are good at is we don't change. We are trained to be neutral and convey exactly how it is. We do not add, we do not omit, we do not edit anything.
Okay.
If there's some unclear messages, we know how to intervene and ask for clarification.
Right.
Because we don't feel embarrassed
Right.
Because sometimes I forget the medical terminology that I always knew, and I always raise my hand, say, interpreter needs to clarify this vocabulary.
Right.
And then I will ask for clarification, or sometimes interpreter needs 1 second, well, I guess it's not 1 second, but 10 seconds to look up the dictionary.
Right.
We are not embarrassed by it. We always ask for clarification.
No one is perfect. Yeah.
Yeah, but when you are not trained, and especially when you are interpreting for your colleague, you don't want to lose your face, right?
Yes.
Especially Asian culture, we have this thing called saving face, and we don't like asking questions. Then you will make things up, and that's not good interpretation.
Right. Myself, I have an experience. When I was a refugee, so we had an interview, and our interpreter had a lack of vocabulary in English, and then I could speak English, so I jumped in. I tried to correct it. What are your thoughts? Can you give us suggestion? Is it a good way if you, for example, if the person knows how to speak English, and then the way I jumped in the middle of the conversation, is that okay?
Totally okay. Yeah,
Okay.
It's your prerogative. Yeah, that's totally okay.
Okay.
Because that happens to me too.
Right.
So I also used to teach English, and then one day when I was teaching English, I wrote school on the whiteboard,
Right.
and it looked wrong. And then my students were like, "No, teacher, that the spelling is totally correct." Like sometimes you just, okay, this seems wrong,
Yeah.
or this is very basic word. I don't remember, like diabetes. I forgot about that once. So I was like, I was frozen. And then my patient, who barely speaks any English, she said diabetes. And I was like, thank you. And then I moved on. Because I can do that because I'm trained
Right.
to accept my limit. So that's the difference between trained professional interpreter and bilingual person.
I loved what you mentioned. Yeah, it's you accept. Yeah. Moving forward, what are some of the biggest gap or challenges in current language access policies in BC or in Canada?
Where should I start? Do we have 3 hours?
We have 10 more minutes actually.
Okay. It all comes down to one thing, so I can just talk about that. Money.
Right.
We need to have money, funding to make language access policy. That is not just loose policy. We encourage people to use professional interpreter thing. We need to have policy mandate, demanding and forcing healthcare providers, legal services, social workers to work with interpreters, professionally trained interpreters. And if they don't, consent patients sign without interpreter should be illegal.
Okay.
Any incidents with utilizing bilingual staff, family members, and friends should be illegal and considered breach of care that we owe to the patient. It sounds like a big thing, but it is happening in Australia and the US. Like, we laugh at Trump so much and we look down on Americans. But when it comes to language access, Canada is way behind. I'm embarrassed to talk to my colleagues in the US and Australia.
Right.
Like, it's embarrassing how lack of language access right we have in Canada. Like, when it comes to that, I'm embarrassed. I cannot laugh at Americans or Australians.
No, that makes sense. There should be more fundings, more opportunities for interpretation. It's really important. There are a lot of people needs interpretation.
However, another thing also is that we need more money to train interpreters.
New people.
So what's happening in last 10 years is I used to teach interpreting at Vancouver Community College, UBC, and Simon Fraser University. All this program got shut down because BC government decided not to fund for the program, and also they always say, it's a budget issues and stuff. Yes, no funding coming from that. And also, the VCC program used to be the best in North America. It got shut down twice, actually.
I've heard about it.
And Simon Fraser University program, I studied it, and then it was going on for 9 years. And the last year, we had a 90 student. How is it budget issue? So I think there's I don't want to be conspiracy theories. I'm not going to talk about it anything more.
Yeah.
So they not only shut down interpreter training program, they also shut down some of the ESL program.
Right.
So how are we supposed to learn?
Right. No, that's
English.
really important.
Sorry for swearing.
No, that's all right. My next question was just regarding that, actually. Do you think refugees themselves should be part of the language access advocacy?
Oh, yes. Please. So I think language access is right.
Yeah.
It's not some afterthoughts. It's not something to have. It would be great to have kind of thing. It's language access right. It's language justice. So I contacted a BC Human Rights Tribunal and talked about it with one of the lawyers there. And she said, this is really great cause and great approach you are taking, but the tribunal needs to hear from people,
Right.
not me. So yes, please ask for interpreter whenever you have access to the service. Demand for interpreter because that is your right.
Right. That funding has been given for you. They're working for you, refugees and newcomers. Please don't hesitate to ask for interpreter. Yeah. Two last questions. I would ask the first one. What advice would you give to newcomers who feels silenced or ignored because of language barriers in Canada, especially in Vancouver?
So the same answer. So what happens, especially in healthcare, for Koreans, because of the different healthcare system in South Korea, you pay out of your pocket. Although their health insurance system is somewhat ideal,
Right.
because you still pay out of your pocket, but not too much, because government also subsidize it a little bit.
Right.
But you still pay out of your pocket. When they come here, they don't have to pay anything. So a lot of Korean patient is always very grateful, saying like, "Oh, thank you so much for your free service and all that." It's coming out of your tax money.
Yes.
So it's your right to have access to healthcare, and it's your right to have access to interpreters. The same thing with refugees. They are accepting, and we are accepting refugees because we find it beneficial for us.
Yeah.
Everything's give and take. It's
Absolutely.
so we are accepting refugees because we learned a lot from you, and we consider you as a great, very important part of our society.
Absolutely.
So we accept refugees because it's good for us too.
Right.
So you don't owe us anything. If anything, we owe you for coming here and then choosing to come to us. So speak up, please, for everyone.
Thank you. Thank you so much, Yong. One last message to the people. If you would like to speak in any language that you prefer, a note or a message or a suggestion to Koreans, South Koreans or North Koreans, anyone who is watching, or people, refugees around the world. And I would love if you speak South Korean, because it's interesting. I usually tell to our guests that speak your mother tongue. It's really interesting to say in your mother tongue language.
Yeah. Well, I will speak some in English first.
Please.
The biggest thing I learned from refugees, not just North Koreans, but also some other refugees that I cannot speak too much about it, but I interpreted for and also met the resilience. That's always something I see. And when I hear their story as I'm interpreting, I'm like, you went through all that and you're still smiling.
Yeah.
Like, I'm just thinking about some of those stories in my head. I just cannot believe you went through that and you're sitting right here in front of me and smiling.
Yeah.
The resilience, I have so much respect for refugees.
Thank you.
So yeah. 존경합니다.
Oh, wow. Thank you.
That means I respect you.
I respect you. Thank you. I like what you said about refugees. You have been through a lot, crossing the borders, crossing countries. You have so much potential, courage, resilience. You can do so many things here. Don't hesitate.
Yes, if you need to have the agency in this society, and you can gain some of those agency by utilizing interpreters and speak up, so you can have what you need.
Right. Thank you so much, Yong. It was a pleasure having you. Maybe we can have the next podcast and next year with a lot of achievements, new projects, new things that you have, so that we can change and bring better options for people.
Yes.
Thank you so much.
Thank you.
And everyone, see you until next time.
안녕.
Okay, you said it. That was good.